If you've been told your blood pressure is too high, you're not alone. Millions of people over 60 quietly struggle with hypertension. It can feel like an invisible weight, affecting your energy, your heart, and even your peace of mind. And while medications can help, what if there were a simple, natural way to support your blood pressure right now, right where you sit? You don't need a gym. You don't need equipment. You don't even need to leave your chair. You just need your breath. In this video, we'll explore 3 gentle, research-backed breathing techniques that have been shown to lower blood pressure, calm the nervous system, and bring your body into a healing state. Let's begin. Slowly, softly, and without pressure. Technique number 1, diaphragmatic breathing, also called belly breathing, the foundation of natural calm, circulation, and blood pressure support. What is diaphragmatic breathing? Diaphragmatic breathing, also known as belly breathing, is a gentle, intentional way of breathing that uses your diaphragm rather than your upper chest. The diaphragm is a large, dome-shaped muscle located at the base of your lungs. When you breathe deeply and correctly, this muscle contracts and flattens, allowing your lungs to expand fully. It's the way we naturally breathed as infants, before stress, tension, and fast-paced lifestyles taught us to breathe shallowly. Shallow chest breathing uses accessory muscles in the neck and shoulders and keeps the body in a mild state of alert. Over time, this can contribute to higher blood pressure, poor oxygen exchange, and chronic stress. By contrast, when you breathe deeply into your belly, you activate the parasympathetic nervous system, the part of your body responsible for rest, digestion, and recovery. This helps lower heart rate, reduce stress hormones, and gently decrease blood pressure levels. And the best part, it's free, safe, drug-free, and you can do it anytime, anywhere. Why it matters after 60. As we grow older, our bodies become more sensitive to stress, and that stress isn't always obvious. Even low-level anxiety, loneliness, chronic pain, or overstimulation can keep the nervous system in a fight-or-flight state, tightening muscles, increasing cortisol levels, and raising blood pressure. At the same time, many older adults develop shallow breathing habits, sit more often with rounded posture, feel breathless with minimal exertion, lose muscle tone in the abdomen, which weakens diaphragm movement, experience nighttime spikes in blood pressure due to poor breathing while resting. Belly breathing helps reverse these effects naturally and immediately. It retrains the body to breathe the way it was designed to, supporting your lungs, heart, brain, and an overall blood flow with every slow inhale. Clinical research supports diaphragmatic breathing as a non-pharmacological method to lower blood pressure. A 2018 study published in the Journal of Human Hypertension found that participants practicing slow, deep breathing for 10 minutes a day showed significant reductions in both systolic and diastolic blood pressure after just a few weeks. Diaphragmatic breathing activates the vagus nerve, which helps slow the heart rate and dilate blood vessels. It also reduces the production of cortisol and adrenaline, the body's main stress hormones that contribute to chronic hypertension. Breathing deeply doesn't just bring in oxygen, it signals safety to your body. And safety is what tells your blood pressure to soften. Soften. How to practice diaphragmatic breathing. Step by step. This technique is most effective when practiced daily, ideally in a quiet, seated, or lying down position. Here's how to begin. Step 1. Find a comfortable position. Sit upright in a supportive chair or lie flat on your back with your knees bent. Rest one hand on your chest and one hand on your belly. Step 2. Inhale slowly through your nose. Take a slow, gentle breath in through your nose, counting silently to 4 or 5. As you inhale, focus on expanding your belly, not your chest. Your hand on your belly should rise. Your hand on your chest should stay still. Step 3. Exhale through your mouth. Gently exhale through your mouth, counting to 6 or longer. Let your belly fall slowly as the air leaves. Avoid forcing the breath, just let it release naturally. Step 4. Repeat and relax. Continue for 5 to 10 minutes, breathing in and out slowly and fully. Aim to do this once or twice per day. You can also use this technique before bed, during stressful moments, or after a walk. As you continue, notice how your body feels. A little lighter, a little calmer, a little more at ease. Tips for success, especially for seniors. Support your lower back with a pillow if sitting. Use calming music or guided audio to stay focused. Practice before meals or bedtime for better digestion and sleep. If lying down is uncomfortable, use a reclining chair or prop your legs. If you feel dizzy at any point, pause and return to normal breathing. This is a practice, not a performance. Start with just 2 minutes a day and slowly build up to 10 to 15 minutes. Even small sessions can make a real difference. While this video focuses on lowering blood pressure, diaphragmatic breathing improves much more. Improves lung function and oxygen absorption, reduces anxiety, worry, and restlessness, strengthens core muscles and supports posture, improves digestion by stimulating the vagus nerve, enhances sleep quality by relaxing the nervous system, reduces fatigue by increasing energy efficiency. The breath is the bridge between the body and mind, and with every deep inhale, we remind the body it is safe. As you practice this breathing, try silently repeating, I breathe in calm, I breathe out tension. With each breath, my heart softens. I give my body the peace it's been asking for. Affirmations are not just feel-good words. They guide the intention behind the breath, turning a simple action into a healing ritual. A simple daily routine suggestion. Morning, 5 minutes after waking, while sitting on the bed or by a sunny window. Afternoon, 3 to 5 minutes after lunch to aid digestion and relax. Evening, 10 minutes before bedtime to lower cortisol and ease into sleep. The more consistently you practice, the more your body will begin to default to calmness, even in moments of tension. You've spent decades supporting others, pushing through, staying strong. Now it's time to support yourself, gently, one breath at a time. Your body may be older, your pace may be slower, but your breath is still strong, still healing, still yours. You don't need equipment. You don't need prescriptions. You don't need to leave your home. You simply need to return to the breath that always loved you back. So tonight or right now, wherever you are, sit still, place a hand on your belly, and give yourself the gift of calm. Inhale peace, exhale pressure, and begin again with grace. Technique number 2, 4 to 7 8 breathing, the blood pressure reset you can do anywhere. A simple pattern that brings calm, slows the heart, and relieves inner tension. What is 4-7-8 breathing? 4-7-8 breathing is a powerful yet gentle breathing technique designed to help regulate the nervous system. It works by slowing your heart rate, relaxing your muscles, and reducing blood pressure, all within just a few minutes. The numbers refer to a simple rhythm. Inhale through the nose for 4 seconds, hold the breath for 7 seconds. Exhale slowly through the mouth for 8 seconds. It's sometimes called a natural tranquilizer for the nervous system, and it's especially helpful for older adults who want a drug-free, side effect-free way to manage hypertension, anxiety, and restlessness. The technique was popularized by Dr. Andrew Weil, a Harvard-trained physician, and is based on ancient yogic breathing, pranayama, adapted for modern wellness. Why it works for blood pressure. Let's talk about what happens in your body during each phase. Inhaling for 4 seconds fills your lungs gently with oxygen. Holding for 7 seconds allows oxygen to circulate and slows your heartbeat. Exhaling for 8 seconds activates the vagus nerve, which tells your body you're safe now. The extended exhalation helps release built-up tension in the chest, diaphragm, and shoulders, 3 places where anxiety and high blood pressure like to hide. This shift from fight or flight to rest and digest can lower blood pressure almost immediately, and with regular practice, it helps train the nervous system to remain calm, even under pressure. As we age, our bodies become more reactive to stress, have a harder time coming down from heightened emotions, may rely more heavily on medications, which can have side effects, need more natural tools to support sleep, digestion, and heart rhythm. 4 to 7-8 breathing is free, safe, portable, and non-invasive. It can be practiced sitting in a chair, lying in bed, during moments of worry, before meals, before sleep, while waiting in line, at appointments, or in traffic. You don't need strength or flexibility, just patience and presence. How to practice 4 to 7-8 breathing step by step. Step 1, find a quiet, comfortable space. Sit upright in a chair with your back supported, or lie down with your hands resting gently on your stomach. You can close your eyes or soften your gaze. Let your shoulders relax. Step 2, exhale completely. Before starting, breathe out gently through your mouth, clear the lungs, and let go of tension. Step 3, begin the 4-7-8 pattern. Inhale through your nose for 4 seconds. Let your breath be soft and natural. Don't force it, just fill your lungs gently. Hold your breath for 7 seconds. Let this moment be still. Holding the breath helps deepen oxygen absorption and pause racing thoughts. Exhale through your mouth for 8 seconds. Purse your lips slightly as if blowing out a candle, and slowly release all the air. This is the most important part. Step 4. Repeat the cycle. Repeat the full 4 to 7, 8 cycle 4 times in a row. As you grow more comfortable, you can gradually increase to 6 to 8 cycles. Optional tips: count silently or use soft background music with a slow rhythm. Use a timer or guided app to pace yourself. Place one hand on your chest and one on your belly to feel your breath movement. Do this 2 to 3 times per day or any time you feel tense. When to practice for maximum benefit. Morning helps start the day with a clear, centered mind. Before meals, calms the nervous system for better digestion. Before bed, promotes deeper, longer sleep by slowing heart rate. During stressful moments, can de-escalate panic or frustration. After arguments or emotional events, helps reset emotional balance. Though the numbers themselves are not magic, the pattern of longer exhalation has been well studied. Benefits supported by research include reduced systolic and diastolic blood pressure, lower resting heart rate, enhanced oxygen carbon dioxide exchange, increased vagal tone, which regulates heart rhythm and digestion, improved sleep quality in older adults, decreased anxiety, especially in people over 60. In fact, many cardiologists now recommend breathwork as a lifestyle intervention for patients with borderline hypertension or elevated stress levels. Breath is medicine. It is the most accessible prescription you'll ever receive and the one you can refill anytime. During your breath cycle, you may find it helpful to pair each number with a calming affirmation. Inhale, 4, I am safe. Hold, 7, I trust my body to heal. Exhale, 8, I release what I cannot control. Or simply count slowly. Inhale, 1, 2, 3, 4. Hold, 1, 2, 3, 5, 6, 7. Exhale, 1, 2, 3, 4, 5, 6, 7, 8. These internal rhythms help synchronize your breathing with your mind, bringing a powerful sense of peace. If you struggle with high blood pressure at night or feel anxious before sleep, this technique is a gentle ritual to unwind. Here's a sample evening routine. Dim the lights 30 minutes before bed, put away screens, and sit quietly. Do 4 to 6 cycles of 4 to 7, 8 breathing. Follow with journaling or gratitude reflection. Rest in silence or play soft nature sounds. Many seniors report that this single practice reduces racing thoughts and lowers nighttime blood pressure spikes. You don't have to fix everything at once. You don't have to meditate for hours. You don't have to live in silence or chant mantras. You simply have to pause and let your breath guide you back to stillness. The 478 technique may seem simple, but like most wisdom, it's in the simplicity that healing hides. So when the day gets loud, when your chest feels tight, when your blood pressure climbs, stop, sit, breathe 4, hold 7, exhale 8, and come home to yourself. Technique number 3, alternate nostril breathing, Nadi Shodhana. Balance your mind, soothe your heart, and lower your blood pressure naturally. What is alternate nostril breathing? Alternate nostril breathing, also known by its Sanskrit name Nadi Shodhana, is a traditional yogic practice used for thousands of years to restore balance between the body and mind. At its core, it involves breathing through one nostril at a time in a specific rhythm, helping regulate the nervous system, support cardiovascular health, and promote deep mental clarity. In modern terms, this technique gently activates both sides of the brain, supports oxygen flow, and calms the autonomic nervous system, which plays a key role in blood pressure regulation. It's not just a spiritual practice, it's a science-backed method to reduce stress, lower systolic and diastolic blood pressure, and improve heart rate variability. Why it works? The science behind the breath. Your nostrils are more than just airways. Each one is connected to different branches of the nervous system. The right nostril activates the sympathetic nervous system, your fight or flight response. The left nostril activates the parasympathetic nervous system, your rest and digest mode. When you breathe only through one nostril, you gently stimulate and regulate these systems. Alternating nostrils brings harmony between the two, calming the heart, relaxing the blood vessels, and reducing stress-related tension. Multiple studies, including research published in the International Journal of Yoga, have shown that alternate nostril breathing reduces heart rate, lowers blood pressure, and improves emotional well being, especially in older adults. Why it's ideal for seniors over 60. As we age, internal imbalances become more common. High blood pressure linked to long term stress, sleep disturbances and irregular heart rhythms, mental fog or emotional fatigue, shallow breathing habits, reduced lung elasticity, and lower oxygen saturation. Nadi Shodhana gently addresses all of these without any physical strain. You don't need to sit cross legged. You don't need to be flexible. You just need a quiet moment, your breath, and your hands. How to practice alternate nostril breathing, step by step. This technique can be done seated comfortably in a chair or upright on a cushion. Step 1. Sit upright and relax. Sit with your spine straight but not stiff. Rest your left hand in your lap. Bring your right hand up in front of your face. Gently press your right thumb on your right nostril to close it. Step 2. Inhale through the left nostril. With your right nostril closed, inhale slowly and deeply through the left nostril. Breathe in gently without strain. Count to 4 or 5 if it helps. Step 3. Close the left nostril and exhale through the right. Use your ring finger or pinky to gently close the left nostril. Release your thumb from the right nostril. Exhale slowly and fully through the right nostril. Step 4. Inhale through the right nostril. With your left nostril still closed, inhale again through the right nostril. Step 5. Close the right nostril and exhale through the left. Close your right nostril again with your thumb. Exhale slowly through your left nostril. That completes one full cycle. Repeat for 5 to 10 cycles, slowly building up to 10 to 15 minutes of practice. Helpful tips for beginners. If your arm gets tired, rest your elbow on a pillow or table. Keep your breathing soft and smooth. No need to force deep breaths. If one nostril feels blocked, breathe gently or wait until it clears. You can do this with eyes closed for deeper relaxation. Use gentle background music or a soft timer if it helps maintain rhythm. When and how often to practice. Morning brings mental clarity, emotional balance, and a calmer start to the day. Before meals helps activate digestion and reduce tension in the gut. Afternoon, useful for clearing mental fatigue and preventing blood pressure spikes. Evening or bedtime slows heart rate and encourages restful sleep. Aim to practice at least once daily, even if for just 5 minutes. The more consistent you are, the more your nervous system learns to return to calm on its own. Alternate nostril breathing helps lower both systolic and diastolic blood pressure, improve heart rate variability, a marker of heart health and stress resilience, reduce cortisol and adrenaline production, balance the left and right hemispheres of the brain, improve oxygen intake and carbon dioxide release, reduce symptoms of anxiety, depression, and insomnia. These benefits are especially valuable for seniors managing hypertension without wanting to increase medications. This breathwork is not just relaxing, it's deeply restorative. As you alternate nostrils, you might mentally repeat phrases such as inhale left, I welcome calm, exhale right, I release tension, inhale right, I invite balance, exhale left, I return to peace. These affirmations anchor your mind and deepen the emotional benefits of each breath. If you experience elevated nighttime blood pressure or difficulty winding down, this is the perfect technique to practice before sleep. Here's a suggested flow. Dim the lights, turn off screens, sit on the edge of the bed or in a chair. Practice alternate nostril breathing for 5 to 10 minutes. Follow with light stretching or calming tea. Enter bed with ease, not tension. The breath doesn't just prepare the body for sleep, it tells the heart it is time to rest too. In a world that often feels fast, loud, and chaotic, your breath is the one thing that remains steady, if you give it your attention. Alternate nostril breathing isn't about perfection. It's about gentle attention, about returning to your own rhythm, about finding harmony between your thoughts and your heart. So when life feels overwhelming, when your pressure rises, when you need something real to hold on to, sit down, close one nostril, inhale peace, exhale pressure, and remember, you are still in control. Your breath is not small, it is your quietest strength. High blood pressure can feel like something out of your control, a silent, persistent pressure that sneaks into your life and robs you of peace. But What if your healing didn't start with a prescription? What if it began with something you already have, your breath? In this video, we explored technique number one, diaphragmatic belly breathing to calm the nervous system and gently activate healing. Technique number two, 4 to 7 8 breathing to slow the heart and restore rhythm during stress or sleepless nights. Technique number three, alternate nostril breathing to balance body and mind, lower pressure, and reconnect with inner calm. Each of these tools is simple, but don't mistake simple for small, because every deep breath you take is a quiet act of reclaiming your health, of softening tension, of telling your body, you're safe now, you're healing. No matter your age, your diagnosis, or your past stress, you can start again today, right now, with one breath. So inhale slowly, exhale fully. And know this, you are not broken. You are learning how to breathe again with wisdom, intention, and grace. If this video helped you feel calmer or more empowered, like this video to support others on a healing path. Share it with a loved one who quietly struggles with blood pressure. Subscribe to True Senior Wisdom for weekly tools for healing, health, and peace after 60. You are still strong, you are still in control, and your breath will never leave you behind. Keep breathing, dear one. You're doing better than you think.